Hello, and welcome to Health is the Key, the podcast that explores the health and wellness issues that matter to 1199 SCIU healthcare workers. I'm your host, Elizabeth Moore. February is American Heart Month, a great reminder for all of us to check in to make sure we're doing all that we can to keep our most vital organ in good working order. This is especially important for women who often experience heart trouble differently than men do. So we're happy to be joined today by Dr. Shivani Verma, an interventional cardiologist at Maimonides Medical Center. Welcome to Health is the Key, Dr. Verma.
Thank you for having me, Elizabeth.
So first, can you just explain to us a little bit about what exactly an interventional cardiologist does?
Absolutely. So essentially, I do right now a lot of what general cardiologists do, looking at the basic functions of the heart, symptoms that people may feel. But additionally, I can go into the heart. So I can do procedures for heart attacks, people who are having chest pain, look very specifically into the arteries. So that's where the interventional portion comes in. It's a little bit more invasive.
So more hands-on.
Yeah, exactly.
Okay. And, as healthcare workers, our members are very savvy about healthcare. And we hear a lot about heart disease. What's the surprising thing that they may not know about heart disease?
I think one of the surprising things is that you can take care of things a little earlier than we think we can. You don't always have to wait to have the heart attack to realize that you're having some struggles with your heart health. So being more preventative is something that everybody can really benefit from. And I think that gets lost on a lot of people a lot of times.
Mm-hmm. I think one of the surprising things I think about is that we focus so much on breast cancer for women. And I was surprised to learn that heart disease is the number one killer of women, that it's a major problem. So what are the risk factors specifically for women?
Well, a lot of the risk factors are the same in regards to the biggest ones, which are smoking, diabetes, high blood pressure, high cholesterol. Some of the ones that are more specific to women are when we have gestational diabetes, if you have preeclampsia during pregnancy, those sorts of things. In addition to that, just some of our hormones, as they shift through our lifetime, do eventually reduce the preventative factors that estrogen usually allows us. So when we're in our perimenopausal, menopausal period of our lives, we are at a higher risk than we were when we were in our 30s.
You had mentioned that we can start preventing it in our 30s. We can start making healthy habits.
Absolutely. And I think just the mindset of being in that preventative mode helps you further on in life. So as you get to your 50s, 60s, you've already created a nice, healthy foundation and you have good habits that you can instill that will prevent further issues down the line.
Right, right. When we talk about symptoms of heart disease, women are known for playing down symptoms and getting on with their jobs and doing so. What are some symptoms that women can experience that they don't always pay attention to?
Honestly, I think one of the most common things that I've seen overlooked is just when women aren't able to do as much as they used to. Something as simple as I used to be able to walk 2 miles easily and run after my kids, but now I can walk 1.5 miles and I have a little trouble keeping up, but I can. Mm-hmm. That can definitely be indicative of the start to something. That's something that definitely gets played down. The other thing is a lot of times heart pain gets mistaken for GERD, gastroesophageal reflux disease or reflux.
Oh, okay. Like heartburn?
Yeah, heartburn, ulcers, those sorts of things. They do very much get misconstrued. And I've seen it as a fellow. I remember we had a 78-year-old patient I saw in the ER after we just had a bunch of other heart attacks come in. She's like, "Oh, I'm fine, honey. I just have a little bit of, I'm burping a little. I have some acid reflux. I'm good." And they did the EKG and she was having the biggest heart attack of the day.
Wow.
So it definitely downplayed a lot in terms of symptomatology in women.
So you should pay attention to that when you're...
Yeah, everything is serious, I think, is the baseline here. Anything different than what you normally feel is something that should be taken seriously.
Okay.
And I don't think that happens often enough.
One of the things that I was surprised to read about was that social isolation can not cause heart disease, but be a factor in it.
Social isolation especially affects women. You do start to care for yourself a little bit less is one of the things. The second thing is it just there aren't a lot of studies about it, but you do not respond as well to some of the treatments. You know, you need a good mental health as a background and consistency in order to respond well to treatments, in order to just establish a healthier lifestyle. There's a key mental component that I don't think is looked at as much. They have shown that generally after something like a big heart surgery, patients do go into a little bit of depression. And when they're in that depression, they're not responding to the treatments as well, or they're not doing as well in terms of the results. And as they come out of that, their prognosis does get better.
That's amazing that it has such an impact on it. We all know that the mind-body connection is important, but you wouldn't think that it would really affect your recovery.
No, absolutely. And especially it's really not studied so much, but the things that they have seen does coordinate with that.
Mm-hmm. So what are some of the other basic symptoms that, like, we hear about dizziness, fatigue? Do they all have to happen at once, or can you feel dizzy and that's a symptom? And then,
yeah, it's a good question. The one thing to also remember that I think we forget is that the heart has so many different components. So not all heart disease is a heart attack. You know, you can have electrical problems, which could give you dizziness. You can have blockages that are very big that can give you dizziness. You can have valve disease that can give you dizziness. So there's so many different components that dizziness can happen on its own or with something. Fatigue can happen with multiple issues or, an artery issue. Shortness of breath is a big one. And things that you used to be able to do, again, that you can't do so much anymore. Chest pain is very big. That really just leads to the blockages and the arteries for the most part. But that's why once you come in with symptoms, you're usually not just going to be given one test to do because a lot of these symptoms do overlap with the different types of issues that can occur with the heart.
Okay. Are there particular screenings that anyone can get, or do you only get them if you're at risk or if you're experiencing these symptoms?
I mean, that's a good question, especially nowadays. A lot more people are going into holistic medicines and such. So there are more things that are offered, usually not right off the bat. So generally speaking, it would be the basic things that you do at an annual visit. So blood pressure is a screening tool. It doesn't sound like it would be, but it's a very good screening tool. Basic labs with cholesterol, your A1Cs, make sure you don't have diabetes. Anything looking at the risk factors for heart disease is a screening tool. So those, I think, are the most important. If you do have family history, a certain number of risk factors, you can go a little further. So they have like a lipoprotein A. So it's more specific in terms of cholesterol. So you can have a normal cholesterol level and then say you have family history. They can do just this little kind of like a deep dive into the cholesterol. Let's see, really, are you still at an increased risk or not? So things like that are available. They're becoming more, I guess, abundant in how much they're ordered as insurance approval is getting into it.
And can you give us an idea of what type of screenings there are? Like EKG, for instance, is that like the basic thing?
I mean, that is the most basic screening. If you're going to see a cardiologist, you should be getting an EKG before they even see you, really, with the blood pressure and heart rate and whatnot. So EKG, absolutely. That is the most basic one. After that, it'll really be based on your symptoms. So not everybody will get an echocardiogram to look at the heart function. That'll really be based on your complaint, your risk factors, and really what your potential risk is.
Should you get an EKG at your regular checkup, or no? That's a cardiologist.
Yeah, that's kind of up to the provider.
Okay.
There are some internal medicine doctors that will do it. There are some that will say, I think you need to see a cardiologist because if we're going to go down this road, I'd like you to be very specific in who you see about this. And there are some who will do it if you're having symptoms in the internal medicine office. And then they'll kind of decide, okay, this is enough for you to go to a cardiologist. I'm comfortable enough dealing with this. So it's pretty practitioner dependent.
Okay. For women who might ignore some symptoms, what is it that you want them to know? What they should pay attention to?
Any change in your baseline, it's something that should not be ignored. I really do think that's the biggest thing, any change. You just don't feel like you can do as much. You feel like you're getting chest pain every now and again, but you never used to. You're getting new symptoms of dizziness. Those are the things to look out for and just not put on the back burner. The important thing is women do put things off more, which means we find things much later, which means they are more at risk of not having good results when things are done to them. So something that's as small as just putting it off in the beginning can lead to a long-term prognosis issue later on.
Okay. What type of, I know there are many different heart issues, but what are some of the typical treatments that women particularly get?
It's a little hard to answer because it's pretty similar to just the general population in terms of if they're having a big heart attack, the treatment would be the same as getting a stent. Obviously, there's like minor nuances where you may or may not get one, but the overall picture and treatments are the same.
Okay.
So medications, stents if you need it, if you need a pacemaker, there are devices that you can get. One thing that's specific to women that men don't get as often, it's not so much a blockage in the arteries, but we can get a little tear in our artery all of a sudden. For some reason, the lining of the arteries can be more vulnerable. And there's not always something to do about it, but it is something that's more common in women, and it really can result in a really bad chest pain in young people. So that's much different than men.
How is that repaired, if that's the word?
It's a very good question. There's not a huge consensus on everything, but you try not to have to fix it. If somebody's having, a lot of chest pain or just something that needs to be done, you can put a stent in.
Can you explain a stent a little?
Absolutely. So sorry. I like to compare it to kind of the spring in a pen. When you take a pen apart, it's a scaffold. So it just looks like a little fence and you put it in the artery and you open it up with a balloon. So it just pushes everything to the side.
Okay.
You think of it as like a plumbing tube, I guess, or a tunnel, and you're just pushing all the junk to the side where you create good blood flow.
Okay.
So that can happen when you have a tear in the artery as well. It's not always just a blockage.
Is there any advantage to genetic testing for heart disease?
For some heart disease, yes. So there's so many different types that some you can argue, some you cannot. But in terms of some electrical things, so sometimes people can have some electrical issues that are genetic. So if you have somebody in the family with, for example, it's called long QT, it means just one part of the electrical thing is taking too long. That requires genetic testing in like first-degree family members. People who have very, very thick heart muscles or hypertrophic cardiomyopathy, that requires first-degree family member testing. So there are things that would be required based on what is found in your family members. And your cardiologist would tell you that. They would say, have your brother, sister checked, have your niece, nephew, etc.
Okay. So I think we were talking a little bit earlier about, I thought that I didn't have a family history, and then I've discovered that 3 of my brothers now have stents. So that would be considered a family history, right?
Absolutely.
So I need to go see a cardiologist.
Yeah, absolutely. And also it depends on the age that people start getting some of these problems. So by the time you're 90 years old, it's just considered age-related. But yeah, I mean, for you, absolutely.
Okay, I'll go. And many women, or I should just say many people, don't feel, if they don't have the right doctor, that they don't feel heard, they don't feel listened to. So how can you advocate for yourself when you're going to a doctor with what you believe might be heart disease, but you don't want to cause a fuss, So how can you advocate for yourself with your physician?
I mean, I think the biggest thing is really, if you don't feel heard, reiterate what you think the problem is. And sometimes you do have to find another doctor. It's as easy as that. But the patient-doctor relationship is very important, not just for your care up front in terms of the physiologic process, but mentally. If you don't feel heard and you don't feel like you're being taken seriously, somebody can be doing the right thing for you or the wrong thing for you, and you'll feel differently about it based on your relationship with the doctor.
Right.
So,
and you were saying how important it is for the mental health aspect of it.
Absolutely. You don't want to sit there second guessing every day. Well, they said it's fine, but I really don't know if they understood what I was saying.
It's fascinating. Yeah.
I think about how I would feel. So I'm like, no matter what somebody tells me, if I don't think they're listening to me, I'm not going to be fully confident in it.
Right.
And then the whole point is for you to live a better life.
Mm-hmm.
So if you don't feel confident in your day-to-day, how is that going to help your life?
Right. Right. And finding the right doctor is the huge part of that.
Yeah, you need somebody you can trust.
Mm-hmm. And it may take going to several.
It may, absolutely.
Mm-hmm.
Yeah. And they can all tell you the same thing. I mean, it's just about who you feel right with.
Right. Who you feel is really listening to you and has your concern, won't just say.
Exactly. And who can communicate it with you the best way that you will take it.
Mm-hmm.
Sometimes it is just a communication issue as well.
Right.
So
right.
it's like a friendship.
Can you share any good news on the horizon about heart disease or women in heart disease in general?
I mean, the good news is there's so many more women going into cardiology. We're still a lot less.
Right.
Yeah, that is still a lot less than the men in cardiology, especially into the subspecialties like interventional. There is more of an advocacy going forward with women in cardiology and patients. There still aren't enough women in the studies.
I was going to ask you about that. Yeah.
Yeah, and I'm not really sure how to go about, I guess, rectifying that or what is being done to rectify that, because it is hard enough just to get a study started, to be honest. But that is something to be wary of in regards to how we are treated. Good news is that people are paying attention. So people are paying more attention. People are listening more because we are finding more things as well. And I think as women, as long as we start to try to look out for ourselves more, that is also the first step. It's unfortunate we have to be the advocate, but you do.
Prioritizing our own health.
Absolutely.
Yeah. As our director, Dr. Donna Ray, says that, you've got to put your own oxygen mask on first before you can help anybody else. And that's what our members do. They're helping others. They're healthcare workers, they're parents, and they're always putting others first.
Yeah. And so it's also in that context, it's easy to think I'm just run down. I worked a 12-hour shift. I had to come home. I had to take care of the kids. Or even if you don't have kids, a 12-hour shift is very, very demanding. So it's easy to just say, well, it was rough. I'm tired.
Just
instead of, I'm actually having a little bit of pain. Or, I think I tweaked something. It's easy to write it off when you have a demanding life.
Right. One interesting thing I thought, I had a friend who went in for their annual checkup and had an EKG just as part of the checkup. And they said she was having a heart attack. And she had no idea. So that, and had no symptoms, no family history. So even that can happen.
It can.
Yeah.
And something like that would be contextualized when you go to the ER. Sometimes EKGs can look like heart attacks and they're not. Everybody is a different person. So I had patients who have had heart attacks and EKG is completely normal. Same thing as the other way around. EKG looks like a very big heart attack, but everything is normal.
Wow.
So the point is really just if there's an issue, get it checked out.
Well, is there anything else you would like to leave with our members about protecting their heart?
I mean, and it's really just about taking care of yourself and taking yourself seriously. If you feel something, get it checked out. If you're worried, get it checked out. Just don't second guess what you're feeling. If it's nothing in the end, great. That's the best news.
Peace of mind.
Yeah, but you don't want to miss something, and you don't want to miss something that you could take care of earlier rather than later.
Well, that's great. Thank you so much for joining us. I'm sure our members are going to get a lot out of this, and we appreciate your taking the time.
Oh, thank you. It's been very fun.
Tune in later this month to our February keynote to hear Dr. Verma discuss a condition known as broken heart syndrome. Yes, it's actually a real thing. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.